Hello, class. Today, my report to the coalition will be about cardiovascular disease. My name is Kiana Baker. Cardiovascular disease. According to the Centers of Disease Control, cardiovascular disease is the leading cause for both women and men. It is also the leading cause of death for people who fall under the African American and Hispanic racial ethnic groups. Cardiovascular disease develops when plaque builds up in the arteries of an individual and the inside of the arteries begin to narrow, which decreases or blocks the flow of blood. Plaques can also burst, and when they do, a blood clot can form on the plaque, blocking the flow of blood. The modifying behaviors that I chose to focus on was physical activity. And according to the World Heart Federation, studies show that doing more than 150 minutes or 2 hours and 30 minutes of moderate physical activity every week or hour of vigorous physical activity every day will reduce your risk of coronary heart disease by 30%, even if you have other risk factors. Obesity or being overweight is one of the major risk factors for cardiovascular disease. Basically, intra-abdominal fat has a significant impact on our metabolism. Intra-abdominal fat affects your blood pressure, your blood lipid levels, and it interferes with your ability to use insulin effectively. You use insulin to process glucose derived from food, our body's primary fuel. If you cannot use insulin properly, you may develop diabetes, which also is a risk factor of cardiovascular disease. The intervention that I selected was to create individualized interventions on a mobile app so individuals are able to access it at their own convenience. Based on the journal article, The Use of Behavior Change Techniques and Theory and Technologies for Cardiovascular Disease Prevention and Treatment in Adults, a comprehensive review with the current level and variety of technology in use among all demographics of U.S. adults using technology to promote health is increasingly appropriate and indicated. In this review, the internet intervention platforms and mobile phone apps were also the most frequently used technologies, but interesting work is also being conducted with newer technologies. The theory that I chose that relates to this intervention is the social cognitive theory, which relates to the modifiable health behaviors of cardiovascular disease, more specifically overweight and obesity, and physical inactivity, because when used with an intervention, it pushes for self-efficacy paired with goals, outcome, expectations, and motivation. It also addresses the social structure determinants of health as well as the personal determinants, a comprehensive approach to health promotion requires changing the practices of social systems that have widespread detrimental effects on health, rather than solely changing the habits of the individual. The final recommendation is the effects of this kind of intervention should be measured by evaluating the individual's self-monitoring behavior, goal setting, planning social support, and behavior maintenance. An effective method in keeping a good measurement of this intervention would be to establish partnerships with private sector health information technology developers in order to better track progress and have these developers also have access to keep track of participants' progress. Though also having a mobile app will have progress trackers and wearable sensors that can also be used with the app to track steps and heart rate and etc. These are my references. Thank you so much.